Okay, hi you guys. Dr. Jessie from CHIRO for Moms here, interviewing Dr. Pam Jordi from Clinic Sofia, one of
Hello.
our very favorite clinics in the metro, and she is one of our very favorite doctors and just a great human. So, do you want to just tell us a little bit about yourself, maybe as a wife and mother and doctor, and then I'll ask my questions.
I grew up in Minnesota. I trained in Omaha, Nebraska I brought my husband with me, and we were there for 8 years and are now back home in Minnesota, practicing with Clinic Sofia, and I'm loving it. We have a great group there, and love being a mom, love being a wife, and just the balance that we get. I think that's important. So,
Awesome. And are you pregnant?
yes, expecting in May.
Just adding to your beautiful family.
Yeah.
I just think that's so cool. Okay, so we're going to talk about C-section today because I have a vested interest because I had two, and I actually had I had some really cool experiences with it. But what I've learned over the years in practicing is that a lot of women don't quite understand what's happening or what it is. So that's what Dr. Jordi is here to talk about today. So I'm just going to start with what is a C-section. If there are any stats, prevalence, what is the procedure? That's,
Yeah.
yeah.
So it's it's a major abdominal surgery, but it is the most common surgery that any woman would go through. It is very common nowadays and it's very safe. Um, but there's certainly reasons that that it's required in pregnancy. So I don't know if we want to kind of go through those indications or
Sure, I think that's great.
yeah.
Yeah.
Um, it's about in the US, the rate of C-section is about 20 to 30%. Lower if it's, about closer to 20% if you're a first-time mom, and depending on if you had a C-section before, we may be closer to that 30% or so if we include everybody. Um, so some indications may be seen before you even go into labor, which could be from placental issues or from position of the baby. Other issues may come up actually during the process of labor, and that's the most common reason for a C-section to be necessary. So that would be things like baby not tolerating labor, and that's detected by monitoring baby throughout the process of labor and following baby's heart rate. Another indication would be that the cervix isn't dilating, which can be for a number of reasons. And typically, providers will give ample time to allow that process to happen, but sometimes it just unfortunately isn't the case. And then there are cases where you even get 10 centimeters dilated, which is fully dilated. And even with pushing, baby just isn't in the right position, or there's just some misalignment between the baby and you that baby can't come down that way. So that would also be another indication for a cesarean section. Um, and these are so unpredictable, which makes it very hard in this situation. And a lot of them are more emergent cases, or like we need to go now instead of having much time to discuss this. Um, so for that reason, I think that's why this video is important, to be able to go through this process and learn why we would recommend it and kind of discuss what we're doing in that process too. All right.
And so that leads us right in. What is it? What's
Yeah.
happening? And even kind of getting into the layers of tissue because that I find so interesting.
Mhm.
It's actually just incredible the process of actually
Yeah.
breaking through that tissue. So
Yeah. So the process of the C-section, so it depends. So if you have an epidural, we can use the epidural for pain management. If you don't have an epidural, we typically have time to do a spinal anesthesia where the medication still goes in your back and you're still able to be awake for the birth of your baby. Very rarely would you have to go completely asleep. And we, as doctors, we prefer that we do the spinal anesthesia or the epidural anesthesia, actually. So once you're in the operating room and we have everything ready for surgery, we go through a number of tissue layers in order to actually get the baby. And I'll focus on the important ones. So obviously there's the skin, there's the connective tissue layer called fascia that surrounds the muscles, and that's really the strong point of the abdomen. We have to go through that. There's muscles in there, but we actually separate the muscles rather than go cut them apart. Um, and then at that point, we're basically in the abdomen after we get through a couple very thin layers at that point. Um, and then we get to the uterus and have to make an incision on the uterus. And then we're a baby. So that process is very quick. Um, Once baby's out, you get to see baby gets warmed up. And then most hospitals, as long as you and baby are doing well, you actually get baby back to you and get to have baby on your chest. Um, I can't speak for everybody, but every hospital, but that is the typical case. And then at that point, hopefully you're distracted enough that we can take our time putting all those layers back together. We want to make sure that we're making sure that, bleeding is controlled and all those layers that are the strong point of your abdomen get brought back together appropriately so that the healing process can start. Um, some things that we also see that may kind of affect the healing process are we also go through vessels and nerve tissue. So that can sometimes change that area, like the feeling along that incision.
Well, and that leads us right into healing. And
Okay.
that's kind of, on our end where we come in. And of course, I say this with a grain of salt because I wouldn't want every patient to go just anywhere. I think you'd have to go somewhere specialized because it's a lot of healing, right?
Yes.
There's a lot going on there, and you have to be very careful post. But I do think it's really important to talk about it because I feel like that part gets missed so often with, I don't necessarily mean with what you do, but with kind of the general world of healthcare. So,
And
um,
it's something, I mean, most young, healthy women don't expect to have a C-section or expect to have a major abdominal surgery in their 20s and 30s. Um, so it's something that's kind of sometimes unplanned for. So it's something that you have to kind of process and get to the point of this is happening. Um, but that healing process, yes, you're going to be sore, you're going to need pain medication, and that's okay. But we do want you to be able to get up and move around that next day, even after surgery. And that can help really enhance recovery at that point. But you are going to be under restrictions for at least 6 weeks after surgery, including lifting restrictions. So nothing more than baby. We will prescribe that you get help with laundry and dishes and vacuuming. Um,
mhm.
yep. So it's really giving time for those layers, that connective tissue layer, the skin layer, those muscles really to come back together and heal so that you don't put yourself at risk for further injury.
um, okay, go ahead.
And yeah, and then once you get to that 6-week time point, it's, getting back into a normal routine, normal daily activity. Um, but it's slow. It's listening to your body. It's modifying things that you can do and need to do, but you can start exercising at that point with modifications.
Well, and then that leads me into kind of the longer term.
Mhm.
When I had my babies, they wanted a year between surgery or a
Mhm.
year of recovery before we started trying again. Um,
Correct. And that's what I typically recommend too.
can you tell us why, kind of in regard to the healing process?
Yeah, so after a C-section, the main concern with the next pregnancy would be the actual incision and subsequent scar tissue on the uterus. So if
Mhm.
we allow that at least a year of healing, that reduces the risk in the next pregnancy for concern with that scar tissue along the uterus. Um, the biggest risk being what's called uterine rupture, but that is 0.8% of a risk in subsequent pregnancies. But that's what we would talk about with a second pregnancy after a C-section.
Okay. And I guess the last thing, and I didn't ask you this prior, but I remember talking to my OB about this again. This was a decade ago, but she had a woman who I think ended up having like 6 or 7 C-sections,
Yep.
subsequent C-sections after. And I know there's, there you'll hear sometimes talk of how many you're really allowed to have in total.
Mhm.
Has that changed? Do you have a certain number that you recommend or don't recommend?
There's no hard set number, no. With each C-section, there does come a little bit more risk, especially depending on how your body heals. Some bodies create more scar tissue in that healing process, and that scar tissue is what creates more layers to go through, basically more problems in the next C-sections.
Okay.
Um, Things can get more stuck. It's just not quite normal anatomy at that point. Um, but some people don't create scar tissue like that. And that sixth and seventh C section is no different than maybe someone else's second or third. And that is something that we cannot predict, unfortunately.
I find that so interesting, just the
Yeah.
way all of our bodies individually
Mhm.
heal. It's bizarre. And on that note, we're just going to end this because we're already capped off. But I feel like this was absolutely incredible and so helpful for so many women. So thank you
Oh, thank
immensely.
you.
And I'm going to hit unrecord here if I can find it. And we'll say goodbye.